Anyway, following a tough act is Dr. Day.
It is a tough act to follow. Thank you very much. Your passion is palpable, and I really appreciate that. And I do want to extend a thank you to Sarah, who connected me here, and to Victoria and Ellen and Chris. Just wonderful and an honor to be here speaking with you today. I'm so excited by so many of the little conversations I've had before we sat down to speak also, and just really look forward to staying connected with people. So I thought I'd give you a little bit of background about, just really briefly about naturopathic medicine, because that's what I do. I'm a naturopathic doctor. And then a little bit about my view on endometriosis. I am on a board of directors for the Endometriosis Association. That's how I was connected here. And then I'll tell you a little bit about my thoughts on the future of women's health. First of all, just I'm curious, are you, who here is familiar with naturopathic medicine? I've heard of that, kind of have a pretty good sense of what that is. Yay, good. That's great. So that's one example of changing times. I've often been in places where, no one had heard of naturopathic medicine, or only a very few people, so that's great. For those who haven't heard of it, just so you kind of know a little bit, as a naturopathic doctor, I'm trained in Western medicine, so the biomedical sciences of understanding what diseases are and how they happen in the body is similar to a conventional medical doctor. So it's not Eastern medicine like Ayurvedic or Chinese medicine, or some different view that way, which I love, and I think there's a lot of value from different views. But I am looking at the body in the same way, and but it take a very holistic approach. So looking at how different parts of the body interact with each other. And looking for underlying causes, and looking at how to support the body's own efforts to heal itself. I have a deep belief in the idea that women's bodies and bodies in general are trying to achieve balance, and that it's our job to help support that process. And being proactive about our health also. So a little bit about endometriosis then. Before tonight, had most of you heard of endometriosis? Is that a familiar thing?
Yeah.
So yeah, great. So again, that's something that in some circumstances you mention this disease and people have never heard of it before. So that's great that it's just raising awareness, I think, is a big step in all of this. I actually am a woman with endo, as well as a healthcare practitioner that helps women with endo. So I know the disease very well from both sides. Surgery has been a very important part of my journey, and I also believe that it's very important to address this disease from the bigger picture view. Asking the question, why do these lesions grow in the first place? What's going on underneath that? What else might be going on in the body that could be creating the environment that allows those lesions to even grow? There are aspects of the immune system and hormonal imbalances that are going on, and I think it's a big part of where we're moving with the efforts to help women with endometriosis is to learn more about that in the bigger picture. And yes, it's important to address the pelvis directly, but it's also important to address the body as a whole, and asking the question of what can we do as women ourselves in our own lives on a daily basis, and as a healthcare practitioner, what can we do to help women that is addressing that bigger picture, looking at why is there so much inflammation, or what's going on with the immune system when there's really imbalances and weird reactions happening. And I believe and have found that personally, and over 1,000 women in my practice, that sometimes it's very simple things that can make a really big difference in addressing those bigger picture aspects. your diet, your nutrition. I think of food as your medicine 3 times a day. We have so much ideas of medicine as a drug, like this one little pill that you take having this big impact on your health. You're like, here's my medicine, it's going to make me heal or make me better. But we often, in conventional medicine at least, discredit the importance of that other medicine that we're taking in, breakfast, lunch, dinner. And so even that, of making those choices about what's going into your body and how that's going to be affecting that bigger picture. Stress management is another thing that I think is really important to acknowledge and work with. I think, I'm in a room of professional women. I know it's like, we have so many demands on us and our lives, and how do we have our place in the world and still take care of ourselves also and keep that balance. But stress, we know, is tied to many different diseases. Even the big 3 in our country, heart disease, diabetes, cancer, all have found links to stress and the inflammatory process that happens when we're experiencing so much stress. And then other things like exercise and what sleep, your body does a lot of its healing and restoration during sleep, so giving the body the chance. And what supplements or vitamins or herbal medicines you might be working with, all of those are tools that can really make a big difference in the experience of women dealing with these conditions, the pain and the period problems. And it's really important to offer these other options to women. So thinking about the topic for today of the future of women's health, I think it's good to remember perspective. I know I'm one that I always think, when I think about the future and how I want things to be, it's important to remember how things used to be. And I think Dr. Najat brought that up, as did Chris, of remembering what the history has been in the world of women's health and the world of women in culture and society in general, and just really recognizing that even not very long ago, and even currently, to some extent in our country and certainly in other developing countries also, that we've come a long way from that already. And just to acknowledge that, and just have a sense of gratitude and thanks to the women who have come before us also, and probably some women in this room too who have made a difference already, and know how much better it is now. And then thinking and looking forward to the future. Women's health, the future of women's health. I think in medicine, women's health has often been thought of as the pelvis. It's, what's going on with the uterus, and you turn them upside down to get their uterus in the right place. That's a very interesting story. That's, what's happening here, and forgetting to look at the woman as a whole body. That's really important to take a step back and realize that there are other aspects going on here. So with that in mind, I was thinking about the points that I wanted to make this evening, and I wanted to speak of where I think the future of women's health is going from 3 different parts of our bodies. And one is that I think the future of women's health is on our minds, and that I feel like we're moving in this direction where women are paying attention to their health and being more proactive and having health be part of the mindset, and recognizing that keeping yourself healthy will make a difference for your own future, or getting your body healthy prior to conception can really make a difference for the health of the next generation. So that idea of just keeping healthcare more on our minds, I think the generation before and some in the past have just not paid as much attention to health. We've been taught to get busy and do other things in our lives. So I think coming back to this place of having it on our minds to take care of our health. I also think the future of women's health is in her own hands. I think that's a really important aspect of what we're wanting to talk about tonight is women taking charge of their own health. The medical system has very much so been built up to be that the doctor has all the answers. And I know that no doctor could possibly know your own body better than you do. And you being an active partner in your care of your own health is vitally important, and I think that's the direction we're going in. And not that there's this heaviness of burden, like, how am I supposed to take care of my health? I didn't go to medical school. So you have partners and guides on your healthcare team that help you, but that you're taking part in that also. And also seeking options. So really, like, I'm going to help figure this out and look for other options. If you don't like what one doctor's saying, go to a different doctor. If you're, if you're getting partial results, but it's just like not addressing everything, maybe you need to combine, integrative medicine is the direction everything's going in, and definitely finding what works for you as an individual and pulling those pieces together. And the third place that I believe the future of women's health is in our voice. And that we are speaking up more. Women have been silenced for thousands of years, and with the movement and momentum that's happening with the women's health movement has made a big difference in that already, but it's still so prevalent in our society, and women are just expected to suffer this idea that periods are supposed to be painful, just deal with it, or hormonal changes happening, menopause. Like, people didn't used to talk about menopause, and now there's a musical called Menopause the Musical. Like, how cool is that? And I'm on a journey to get perimenopause more talked about. I still have patients come to me 45, 47 years old, irritable, irregular periods, can't sleep at night, and their medical doctors or gynecologists might be telling them that it couldn't possibly be perimenopause, you're too young. And just, recognizing that, like, hormonal changes happen, and it's good to talk about those things. I have patients who are like, none of my friends warned me about this. So just speaking up for ourselves in the medical environment, plus sharing with each other, I think is a really, really powerful part of where we're going, and connecting with other women and sharing experiences. It's one of the things that I'm really excited about developing in my own professional development. I have a private practice where I work with patients one-on-one, but I'm also doing more and more of group work and online and workshops and creating teleclasses and webinars and online opportunities to connect with each other. Some apps that we started talking about a little bit tonight are really exciting, of where technology is going with all of this. I think that the future of women's health has more technology use and less technology use. Getting back to some of the basics, like how you eat and how you're taking care of yourself on a day-to-day basis, the common sense medicine. So kind of both directions with that. And speaking up, even if it's something that isn't socially acceptable, like periods and bleeding and sex and feeling miserable, and just really trying to be real and speaking up and asking for help and seeking help, and not suffering in silence. So that's what I wanted to share with you. So I'm very excited to be here, and welcome to questions later, I know. So yeah.